This video is brought to you by Haven House Recovery Center. What are the side effects of smoking weed laced with PCP? Drug users were soaking cigarettes in PCP since the early 70s. Since then, this practice has become a favorite of both teenagers and young adults. Unfortunately, the side effects of smoking weed laced with PCP are just too many, including lung injuries. What is PCP wet? The phenomenon of wet drugs is now very common. Health experts coined this term to refer to marijuana or cigarettes dipped in phencyclidine, an anesthesia, or formaldehyde, or both. While weed is the most popular option, herbs such as oregano, parsley, and mint may also be used to create good wet joints. In fact, others like smoking menthol cigarettes because weed can be extremely hot and irritate the mouth and the throat. Smoking herbs will likewise produce odors that will help disguise users from those who are familiar with how PCP normally smells. Why do people dip joints or cigarettes in PCP? Wet PCP became popular because it creates a strong hallucinogenic effect when smoked. This effect adds to the potency of nicotine and marijuana. Also, a cigarette or joint dipped in phencyclidine, which is now classified as a Schedule II controlled substance in the US because of its high potential for dependence and abuse, burns at a very slow rate, which gives users a prolonged drug experience. With smoking, delivery to the bloodstream is also faster. Because smoking of cigarettes is legal in all states, and weed is legal in some states, this at least appears to be safer and more normal as compared to other methods like shooting and sniffing. What are the effects of PCP-laced weed when smoked? PCP smoking is done recreationally to get high. How people react to weed laced with PCP will depend on several factors, including age, gender, body composition, dosage, and frequency of use. The symptoms of weed laced with PCP may make a user appear euphoric, relaxed, amused, giggly, active, overconfident, disinhibited, creative. However, smoking PCP-laced weed may also cause side effects like nausea, vomiting, anxiety, confusion, racing heartbeat, high blood pressure, panic, delusions, hallucinations, which is more commonly referred to as PCP trip, paranoia, psychosis. These side effects of smoking weed laced with PCP are more common for first-time users and abusers. The dangers of smoking weed. Health impact. This practice can damage your short-term health in several ways. The common symptoms of weed laced with PCP include a long list of potential problems like unconsciousness, loss of normal body balance, poor memory, and vision problems like PCP nystagmus. How long PCP stays in your system is greatly affected by frequency of use. If one smokes it over a long period of time, the side effects of PCP-laced weed can be disabling. Long-term users are prone to developing lung problems, heart attack, loss of muscle tissue, brain damage, disrupted growth in young adults, spinal cord problems, and even coma. Repeated smoking of PCP-laced weed may also cause some types of cancer. Social dangers. Users often have a strong sense of strength and invulnerability. Angry outbursts, aggressiveness, or any other violent behaviors are among the side effects of PCP-laced weed. These may lead to actions that are unintentionally dangerous and harmful. Others may also think that they are impervious to harm, which may cause accidental injuries and even death. One of the most dangerous side effects of smoking weed laced with PCP is violence. Users who are high may be confrontational, and when they perceive pain inaccurately, this may cause some serious physical injuries. There were also cases of murder after using PCP and weed. Users sometimes cannot remember the events because of drug-induced amnesia. Recreational use of PCP-laced weed. As this method of drug abuse creates euphoric feelings and heightened social abilities, smoking PCP and weed has become a favorite pastime of teenagers and young adults. In fact, according to the National Survey on Drug Use and Health, more than 6 million people in the US in 2011, ages 12 and above reported lifetime use of PCP. ER visits have increased by 400% between 2005 and 2011. Despite being a Schedule II controlled substance in the US, it is very much available on the streets for public use because of its high potential for dependence and abuse. People use PCP to lace weed for fun and socialization, which may turn into a habit. Eventually, they use higher doses to increase the high. Dependence on weed laced with PCP soon starts to develop, and it becomes extremely difficult to stop smoking. Abruptly stopping use will cause intense cravings and withdrawal symptoms. Such signs and symptoms of weed laced with PCP can be fatal, if not supervised by a medical professional. While there are still no specified treatments for PCP dependence, users who have chosen to stop may find comfort in enrolling in a Christ-based recovery center like Haven House. We help to change our residents' lives for the better by guiding them to grow spiritually through recovery. We do work therapy for our recovering men. By spending time at our thrift stores, we help them learn and develop new skills, practice discipline, value hard work, build relationships, and work toward a common goal. This program will help them become contributing members of their communities as soon as they leave the facility. If you are looking for a Murfreesboro Recovery Center, consider Haven House in Hartsville, Tennessee. Call us now at 850-622-3774.